Fortunately for me, I've been away from, I've never really had any health problems until I was diagnosed with diabetes. Matter of fact, I avoided doctors like the plague. The results came back and the guy says, "You have diabetes. I'm sending you to an endocrinologist here at the Mayo Clinic." And so he lined me up with this gentleman who I'd never met. And he recommended the treatment of insulin, the insulin shots. I had no idea what anything else was or what my options were. I was just completely vulnerable, and whatever you say is going to work. As time went on, I started educating myself about different things with diabetes and the disease and treatments. Through Dr. Montori's group, the Diabetes Research Advisory Group, we helped develop some of the decision-making tools. And so as a patient, I've been a part of helping to make the tools that'll help other patients, and I see how that process works. Well, shared decision making is the doctor and the patient sitting down and discussing different options, and from the patient's perspective, what would be the best treatment that fits their needs, and the doctor being open to work with the patient in explaining the different options. I do think that it is a more successful, it's a team approach, and it's, I think, in my mind, a better way of doing it, because you feel like you're working together rather than he's telling me I got to do this and I don't want to, you know. Actually, I had a cardiologist who was encouraging me to take it, and I didn't want to. That was just my feeling, and I just didn't feel that it was necessary. And then we had been working on this decision-making tool, and I expressed to Victor and Audrey that I had this situation, so they spent some time with me and we went through everything. And it was a shared decision-making process where I came to the conclusion that it'd be good for me along with them, but it wasn't somebody telling me, you have to do this. There's a difference, The key to me is knowledge. For me, the shared decision-making, I'd recommend it to any patient. If you place a value on your health and your treatment, I would think an initial amount of time, a fair amount of time spent, may save extra time in the future. Once I got educated and knew more about what I was dealing with, I felt that the team approach worked better. It was more effective. I appreciated being a part of the process versus being on the outside and told what to do.